everyone, I'm Sophia for UBTV, and today for Endometriosis Awareness Month and International Women's Month, we're asking women their experiences with periods, the pill and women's healthcare as a whole. What is your kind of general opinion on female healthcare as a whole?
I can only speak from my perspective as a black woman, and a lot of literature and evidence show that black women are not listened to in the healthcare. It's sad, like some people have lost their lives, especially pregnant black women, where people like underestimate the pain they're going through. There's a lot of I guess, just racism in that institution. And it's just a shame, I think. There's a lot of stereotypes as well, and it's a shame that we're losing a lot of lives because they just don't listen to us. And I think for women as well, I think those stereotypes exist.
So I'm a med student and I work in Southmead Hospital, so I have a lot of interest in accessing making sure that healthcare is more accessible for women, as I think they're often overlooked, especially in research.
I think it's advanced in the last couple of years at least, but there is definitely a lot of work that needs to go into it, especially with the whole just general opinion of women's healthcare. Some people overlook it and think it's insignificant when actually we matter as well.
I mean, as far as GP appointments and such that I've had, it's fairly good, but I think in terms of education, like secondary education, that I had probably not so much.
What's your kind of opinion of doctors putting women on the pill or some form of contraception as kind of like a cure for their periods?
I think it's quite like a generalised idea to just put women on the pill as a solution, and I don't think it's like a one-size-fits-all kind of way of going about that. I mean, from my experience, I do know women who have gone through that, and it's definitely just a way of dismissing that issue, and I think that there's not enough awareness about women's issues. And even when you have a women doctor, a female doctor, it's you still might get judgment from that. It doesn't really matter the gender.
I don't think it works for every woman. I think if you make that big assumption, you're putting lives at risk.
So I think it's getting better, but it definitely needs a lot more research into it. So I think what you're probably referring to is endometriosis, which is a really complicated disease that we just don't know enough about. And I think because it primarily affects women, there's less research into it. So there's just less money to fund it, to fund the research, which is really frustrating, because it's completely debilitating, and at the minute the pill is the most effective treatment we have for endo, and also polycystic ovary syndrome, and it's just frustrating that the pill is the best medication for these treatments currently, for these diseases currently, because they're just not effective.
I think it's just kind of an excuse to try it out. They haven't really from my personal opinion, they don't really speak to you about any of your symptoms. They just forcibly prescribe it to you. So I think that really needs to change as well. There could be many other options and pain relief that we can use instead of straight hormone treatment, because it does mess you up. It's not great.
I think that there's quite often this concept that or expectation of women dealing with pain, so coming and complaining about period pain, the solution to that is another form of difficulty, that it's kind of just accepted as a burden that you have to bear. So you're struggling with period pains, but here's a pill that will give you mental difficulties or other such problems instead. So I think that's seen as a quick fix that's the side effects are dismissed quite easily sometimes.
And with the pill, have you had any horrific side effects if you've been on it, and things you weren't kind of aware of that could even happen?
So funny story. Actually, I suffer from migraines, and my GP gave me a combined pill, and then I had a review on the pill. And then they went to me saying I need to stop straight away because I have migraines. And I was like, okay, why? And they said that I was at heightened risk of blood clots. But they didn't tell me that when they prescribed it to me. And then technically not meant to prescribe it to me if it's going to put me at risk of a stroke and blood clots. So I was on that pill for about 4 years until they told me that. Instead of being so quick to prescribe these things, I actually realised like the person's general well-being and health.
Yeah, no, I had like a similar experience, and they're like, I have one migraine, never had a migraine before in my life, and then they're like, quick, get off it, and then they're like, oh, actually you can stay on.
So when I started the pill when I was 16, and I used to like throw up every single month when I took the pill, and I just think I just sort of like accepted that as like normal. And looking back, like as a 16-year-old, like that is not something that you should be going through like every month. And I think there is like a lack of education of like all the different types of like contraception and like ways of controlling your period. And I think like the pill is definitely just like the most like common one that's just sort of like thrown out there.
So with things like that, like say women who do suffer from migraines who maybe aren't aware, like what sort of things could like the government and kind of healthcare professionals be doing as a whole to kind of raise awareness and say like, you shouldn't be on this and there should be alternative options?
I feel like they should actually give you a proper assessment. People are too quick to prescribe these things almost as like, oh, just get it over and done with, like stop crowding our NHS kind of thing. I feel like it could be like just a simple questionnaire because people are more at risk of like the adverse side effects, and it should be more known. It's not fair that we have to kind of find out ourselves the hard way.
We just need more funding, really. There just needs to be more funding into research on everything to do with women's health, especially endo, polycystic ovary disease, even like menopause. I know the government's currently debating some new menopause legislation that's just being like shut down at every stage, which is really frustrating.
I mean, I think in terms of like secondary school, being fully aware of the different options available, different options, not only just like, oh, there's the coil, the implant, the pill, but of specifically the pill, all the different varieties that you can actually pick from, and that you do have the agency to like discuss that with your GP rather than just accept whatever it is you're given. And then, you know, also the fact that that doesn't have to be the only solution, is like having some form of like official contraception, that, you know, I don't know, other ways of managing like period pain and period difficulties that don't necessarily mean stopping it altogether as well. I think there's like just a lack of that kind of information.
I think there definitely needs to be like more investment into this sector. Like I think that over recent years, like more and more people are like speaking up about experiences, and it's very clear that like there is an issue in the UK with like lack of understanding and education on women's issues. I think it would have to be done in a way that like asks women who are comfortable speaking about their experiences and not just sort of like assumptions, because there's no point like having research and having education if you're not asking people who are directly experiencing it.
I think it all starts with training, like training your staff, like removing those biases, those like stereotypical and like prejudiced attitudes as well, and just listen to people, listen to your patients, listen to the people that are coming in, because it's true experiences, like they're in pain, so help them.